Welcome to Healthy Dose. Learn to repair damage, replace key hormones, and regenerate your body. Get ready to take back control and reclaim your life. Now's the time. Here's your Healthy Dose.
Welcome back to Healthy Dose. I'm Dr. Joe Gambardella. I'm here with our special guests, Christina Alvarez. She is our physician assistant at APMR Miami, and as always with my co-host, Dr. Buzz Korth, up in sunny Ohio. How you doing, Buzz?
Awesome, man.
It's good to be back.
Not so sunny today, though. Not so sunny.
Yeah. It's been a long time since we were on the show together. Lots has happened. I mean, we touched briefly on one of the other podcasts about COVID. So we want to give some information about, what some things are that people could do in their recovery. I think at this point in time now, whether you're up in Ohio, whether you're in New York, New Jersey, Florida, California, there's a lot of our patients that are experiencing really similar concerns, similar symptoms, whether it's post-COVID infection, whether they had the vaccine and had some reactions to the vaccine, stemming from chronic pain, chronic fatigue, difficulty sleeping, chronic headaches. I think the medical term that they're using now is long COVID. So a vast array of symptoms. I know we've spoke about this at length, Buzz, that one of the things that was a shortcoming of the information that came out during the course of the pandemic was a lot of the information that was put out was about whether you should be vaccinated, whether you should not take the vaccine, and a lot of the public information really was in that arena, not on the fact that there's a lot of personal responsibility that we have, that we could take our health in our own hands. The things that are undisputable at this point that we really should have been communicating to our patients on a more public scale was that if you weigh less, you're going to have better outcomes with COVID. If you are not diabetic, if you don't have type 2 diabetes, if you don't have metabolic syndrome, if you sleep more, if you have elevated levels of vitamin D, you're going to have better outcomes. So I think the public health message really should be, what can you do, aside from whether you've taken the vaccine, not taken the vaccine, to deal with the complications of COVID? And this is why we have Christina in today, Buzz, to talk a little bit about or help us navigate through some of the things that we could do after the fact. Do you have similar thoughts, in dealing with patients that have come to you that have had the vaccine, that had some reactions to that, or that had negative consequences from the COVID vaccine, like similar long-standing problems in the patient base?
Yeah, and I've also seen a lot of, and I think we talked about this too, a lot of my patients who had autoimmune disorders, in particular, once they got vaccinated, those autoimmune disorders got much worse. So, we had some patients with scleroderma, Raynaud's syndrome, lupus, and it seems like these autoimmune conditions, in particular after they were vaccinated, have really flared up on these people and having, it's become really problematic.
One of the things that Christina was going to talk to us today was on a systemic cellular level. What are some of the things, in addition to others that we've spoken about, of course, doing your lab work, balancing hormones, what can you do, something immediate that can give you some relief at the cellular level so that you could start to build health again after this long confinement where people have not had access to adequate sunlight. They haven't taken vitamins the way that they should. They haven't been socializing. So mental health has really suffered. I know there's an epidemic now of people who have had overdoses. So let's start to move away from that and talk about some of the good things, some of the better things that are available now to help you start to feel really the way you want to again after this virus. So Christina, why don't you talk to us a little bit about IV therapy?
Okay. So where do you want to start?
Well, a lot of people will come in and they say, well, I'm taking vitamin D, I'm taking vitamin C, but I still feel poorly. I don't have good recall. I have brain fog. I'm not sleeping well. And then
there's a lot of that post-COVID brain fog or just even kind of memory issues. So we just started our IV therapy now, and what we're looking at is 75% of Americans are chronically dehydrated, which I mean, you're talking about somebody who's already wellness inclined, or just the general population?
Well,
because the general population, I feel like, is the one that pretty took the hard hit with COVID. Because most of us are metabolically unhealthy. We have poor sleep. We have poor diets, sugar, processed food, refined foods. And a lot of the issues we're seeing is that, so glutathione, which is an antioxidant, helps kind of regulate the free radicals in your body, prevents inflammation and cell damage. It just came out with a study that low levels could be one of the major causes of what we were seeing with the excess inflammatory response in those who had severe symptoms from COVID. So you're talking about, again, metabolically dysfunction, things like that, where the average American, I think, if they had worsening symptoms of COVID, it was because of their prior, how do I say this, poor metabolic state. A lot of these things are produced in the liver, like glutathione. So you're obviously trying to bank on the fact that your liver is in good standing and in good health. So aside from liver enzymes, doing that simple blood test, you can also look at, well, in terms of hormones, like estrogen dominance. People who are estrogen dominant would have a sluggish liver, trying to kind of detoxify all that estrogen. And then you guys see that all the time. It's not so much that the labs are bad, but the symptomatology with estrogen dominance that I guess you can speak to.
Buzz, you want to touch on that? A little bit about estrogen dominance, what we see in our labs?
Or even
we see quite a bit of it. I think it's a lot of it. I mean, you guys would probably agree. Even our diets today, and in particular during COVID, a lot of people, got out of the habit of exercising. So they put on weight, and people have to understand that body fat is an organ, and it's metabolic in nature. And the more body fat you have, you tend to produce more estrogen. So, I think COVID not only got people out of the habit of doing healthy things like working out and just getting out in public, and they got to get back in the habit because we have to keep moving. So, but because of this excess body weight that a lot of people put on, we're seeing more and more of this estrogen dominance and vitamin D deficiency.
Yeah, I wholeheartedly agree. When we run labs, I think one of the most common findings that we see is type 2 diabetes, pre-diabetes, or the metabolic syndrome, which is you're not quite there at the point where you could be classified as a pre-diabetic, but you're struggling to lose weight. As you mentioned, you have fatigue after a meal, you could fall asleep. You're driving down the road, red light, and you almost fall asleep when you're just stuck in traffic. Those are all symptoms of metabolic syndrome, as well as an expanding waistline. The gyms are crowded now, so hopefully people are getting out and about and starting to take charge of their health. But I would also say that one of the requirements that we have of our patients is that they do lab work, and even the ones that feel like they're in good health, that they've been supplementing well, they take the basic, our core 4 in the office that we really find that most people benefit from is taking some form of an essential fatty acid to decrease cardiovascular and musculoskeletal inflammation, as well as inflammation that affects the brain. We like people on a good healthy dose of vitamin D supplemented with K2, CoQ10, and a multivitamin, multi-mineral. So that being said, even the good ones, Christina, right, that come in, that are supplementing well, will find deficiencies. Sometimes we'll find irregularities in the liver enzymes, low vitamin D, and they think they're doing well. A lot of that has to do, as you mentioned, because of dehydration, but also because of poor absorption, which segues into IV. One of the general numbers I have, I don't have a source on this, is that everything that we take orally, we may absorb up to 35%. The rest that we excrete, so when you take a lot of vitamins and you go to the bathroom, you realize it changes the color of your urine. It smells like vitamins, so you're only able to absorb so much orally, versus taking an IV. The absorption is much, much, much higher. So
when you're talking about absorption, you're talking about two different sources. So diet is one way to get in these vitamins and minerals, and then you're basically going to absorb that in the small intestine. And then the other way to get these vitamins is through your microbiome, the bacteria in your large intestine. So they'll be responsible for making, your B vitamins and things like that. So again, you're kind of predicating on the fact that you have a healthy GI system. and that it's functioning properly. But people, I mean, you can just look at our population: intestinal diseases, celiac, gluten intolerances, diverticulosis, any kind of genetic disorders, alcohol consumption, drug interactions. There's a million things where it's affecting the actual health and function of the GI system. So even if your, let's say in a perfect world, dietary consumption was 100% bioavailable, you're now depending on your GI system to be able to actually absorb that, which it's not plausible, especially with what we're looking at in terms of the general population. What else was I going? Oh, so microbiome, it's a big one. So even if you don't necessarily have celiac or any kind of other disease, I guarantee you probably have a crappy microbiome. If you've been on antibiotics long term, if you've had any other kind of medications, there's plenty of literature out there dictating how the microbiome affects every part of our body. It's basically like its own organ at this point. So if that's not in line, you're not going to absorb anything that you're taking in orally the way you would through an IV. And then you're also talking about therapeutic dosing. So if I want to take calcium or magnesium at a dose where I want to be able to like target something specific, like let's say magnesium's been documented to have a great effect on vascular smooth muscle relaxation and bronchial spasms. There is no way I'm going to get the optimal amount of magnesium to achieve that result without shitting my pants. Like there's no way that's happening. Like you're going to have to dose magnesium crazy high, which is basically what all those laxatives over the counter are. So in order to actually facilitate this result, you're going to have to do that IV. Unless you like wearing, depends, diapers. I don't know. Vitamin C is another one. So documented for antiviral, like herpes, cytomegalovirus. Obviously, anytime you were talking about like you immune boosting or the flu, you want to do high dose vitamin C. Well, you can do high dose vitamin C orally, but if everyone's chronically dehydrated and we're not careful as to our fluid consumption, high dose vitamin C can be kind of a double-edged sword in which now you're putting a strain on the kidneys. Now we're looking at kidney stones and things like that, which when you do it through IV, we can actually titrate the dose specifically, make sure that you're getting the adequate fluids to be able to actually process that vitamin C, use it effectively, and not do more harm than good at the end of the day.
And for those people, that have ever been dehydrated after a hangover, after a chronic illness, and they take you in, the first thing that they do is they hook you up with a line.
Saline, and immediately you feel better. Like there doesn't even have to be meds in there. You're just like, oh my God, thank God. Like I have fluids in my body. I mean, that's anecdotal, but I would say most people, if you had a hangover and you got an IV, you would immediately feel some relief.
So Buzz, the reason we actually started moving towards IV, it's been a slow process, but it's finally here. Was really based upon patient want and need. We've had plenty of patients. I think the vast majority of people now have had some exposure to COVID, and a lot of them, probably more than the documented literature says in terms of a percentage that have long COVID. Just about everybody who's had it has some long-standing reaction to it. One of the most common ones that we've had though is the brain fog, and I could first-handed. I used to be able to remember page, verse that I read something years ago, and after my exposure to COVID, it's one of the long-standing symptoms that I had. I literally had patients finishing my sentences. I couldn't remember the beginning of a sentence when I got to the end, and so that, along with chronic fatigue, the autoimmune conditions like you mentioned, people with quote unquote atopic dermatitis, dyshydrotic eczema, all of these things that are showing up that weren't prevalent before, we're forced as a practice to deal with things that we never had to before.
Right.
And so this particular type of IV, NAD, I kept hearing about it from patients. Should I take oral supplements of NAD, NAD plus? What is NAD? And that's why Christina today did a little bit of a deep dive into NAD. Have you heard of it, Buzz? Have you had any of your patients in anti-aging? I know you're big in that field. I know you're familiar with telomeres and chromosome length as it relates to longevity. But do you have much exposure with NAD?
There's not a lot of people using it, at least up in my area, at least that I hear of. Obviously, when we do our conventions and all the anti-aging stuff, that's a new hot thing that's discussed quite a bit. But I don't think readily available to the public as of yet.
So listen to this. Listen, Christina's got some info on it. Like, being a bit selfish, I think this is one of the reasons I brought it in, is because one of the primary uses is it does target areas in the brain that help with recall, and I think that's an essential part, of any practice where you want to be able to remember what you read. You want to remember what your patients said. You want to remember all the things that you need to do to treat them, let alone the everyday person. You want to remember your bank account number, your PIN numbers. I've had patients tell me they've been using a PIN number for years and years, and one day to the next they forgot it. So, Christina, just refresh us and refresh me about NAD and the interaction in the brain, why it's so important.
Well, so it's basically a coenzyme. So what that is just it assists actual enzymes to do their job. So there's over 300 enzymes in the body that actually are known to use NAD for their activity, meaning they need it to be able to do the functions that it needs to perform. So it's basically important in every cellular level across the body globally. So repairs, preserves DNA, extracts cellular energy from nutrition. It actually protects chromosomal and mitochondrial function. So when you're talking about mitochondrial function, the brain and the heart are the organs that have, I think, the highest concentration of mitochondria. So if you're able to assist this, then you're actually talking about improved cognition, improved memory. You can stimulate cellular regeneration. You can actually make the body a little bit more efficient in terms of regulating healthy cells versus, dying cells that we need to get rid of, like this recycling mechanism. You can restore metabolism. I mean, it's basically, if there's a function in the body, NAD has probably got its hand in it in some capacity. Also interesting to note, it's great for addiction recovery. So you were talking about how there was definitely spikes in, unfortunately, when people were socially isolated, in relapses with people who had drug or alcohol abuse. So not only does it do the actual physical detoxification, like it actually reduces the negative symptoms of the withdrawal. And interestingly enough, it can also assist in the serotonin production, which kind of helps with that psychological component of rehabilitation. And anyone who's ever been down that drug and alcohol rehab path knows that there's always a psychological component with that. So if you can assist in serotonin production, you can also kind of combat the depression that goes alongside with the physical manifestations of an addict or recovery period like that. I mean, it's a pretty, it does everything.
Yeah, if somebody was looking to get into, they wanted to start IV therapy, they don't know which one to start with. This is a pretty all-encompassing one because...
I mean, it's definitely a heavy hitter, though. You have to be cognizant of the fact that most IVs pretty much take, let's say, 30 minutes to 45 minutes to actually do a whole push if you're just doing a basic, saline bag, a couple vitamins, some magnesium. This one, you have to plan for, they say 3 to 4 hours. Some people can do it in 2, just because you can't push it that quickly. You'll get symptoms like chest pain, some tightness. You just feel like a literal adrenaline rush. So you just have to plan for that. But people
slower,
definitely feel like...
Slower the better, right?
Yeah, slower the better. But average is about 2 to 3 hours. We say 4, just, you don't want to piss people off. Bring your laptops.
But our patients that have started these, it's like going from regular TV to high definition. Like, you didn't even know you needed it until you took the infusion.
Right. It's like that Limitless. Was that movie?
Yes.
Where you wake up and you're in a whole other
Buzz, interesting
realm.
Here's another interesting point. Buzz he's pretty much an expert at this point on cellular medicines, regenerative medicine, and we've dabbled, more than dabbled, in the way that the body works internally, how cells signal. Buzz was a pioneer in bringing into at least our community alpha-2 macroglobulin therapy, which is a therapy to control overactive enzymes in joints that cause inflammation and arthritis, leading to joint pain. This is one of the ones that goes along with this, Buzz, to decrease inflammation, to enhance the function of a lot of the cellular medicine that we've been doing in our practices.
So are you doing it with all your patients then that are doing like any type of anti-inflammatory or regenerative type procedures?
In an ideal world, yes.
Yeah. It's like telling a patient, you're going to get better outcomes if you stop taking non-steroidal anti-inflammatories, well before your procedure, limiting the amount of alcohol that you take in before a PRP procedure, or not exercising too soon after a procedure. You're never going to have a perfect outcome, but yeah, we've seen better outcomes along with some of the other therapies that we brought into the practice with some of our more complicated patients.
Nice.
So, can you let's do this. So here we have a patient that comes in. I'm going to give a scenario, Buzz, that has advanced osteoarthritis in the knee. So much so that if you treated the patient on diagnostics alone, it would be a surgical patient. And we work with orthopedic surgeons in our practice, whether it be for the knee, the spine, the shoulder, and the criteria is pretty much universal. If the patient does not have significant pain, they're not going to do surgery. It pretty much crosses into a surgical case when pain is not controlled without medication, or the medication that you're taking is causing damage to another organ system of the body. In other words, the GI tract, the liver. Mm-hmm. So imagine you get these patients that have bad joints, but they clear that first hurdle. They're not in a lot of pain. They're in pain, but not a lot of pain that would make them a candidate for surgery. And then B, another candidate, another prerequisite for surgery would be that activities of daily living are limited to the extent where they're losing their independence. They can't walk on their own. They can't get in and out of their car. They can't use the second story of their home. But what about the people? So any surgeon that meets with a patient that says, well, you're carrying on your activities of daily living, your pain is not controlled with medication yet, go home, live with it, take anti-inflammatories. Well, you came up with A2M therapy, and I'm going to tie all this in together, how IVs could work with this. But can you just touch on what A2M therapy is and how it works with a patient with chronic pain that is not surgical yet?
Yeah, so basically the A2M works. If anybody has arthritis, all arthritis is caused either due to overuse or trauma or surgery for that matter. When you have these traumatic type events, your body secretes these proteins called proteases. And the reason your body secretes these proteins into these areas of trauma, overuse, or surgery is to help clean up the damage from the procedures or from the overuse. So they're secreted for a good reason in the beginning. Where it becomes problematic is once we get above about 25 or 30 years of age, those joints become avascular and they have real poor circulation. And these proteases are very large proteins, so they get trapped in the joint. So when they get trapped in the joint and they clean up the damage from the overuse or surgery, then they slowly start to eat away. Think of them as they're bugs in a garden. They slowly start to eat away at the synovium and the cartilage in the joint. And that's basically at a molecular level what causes arthritis. It's caused from proteases that are trapped in the joint. So, and that's why arthritis happens slowly over time. So no matter what therapy you do, hyaluronic acid, cortisone, traditional medicine, none of those address the proteases or get them out of the joint. And that's why if you don't address them sooner or later, you're going to have to replace that joint. So A2M is a new therapy that's available in basically A2M or alpha-2 macroglobulin is another protein that circulates in your blood. 99% of it's produced in the liver. But what they found is, but the problem is it's so large it can't get into your joint. So it's circulating in your blood, it can't get into your joint. What we're able to do, I know you're doing it, your clinic with great success, we're using it also, is we can take a person's blood, concentrate that A2M molecule down, and then inject it into the joint because it can't get there without us injecting it into the joint. But when you inject it into the joint, it binds with those proteases and literally stops arthritis at the molecular level. So anybody who has any type of osteoarthritis, degenerative joint disease, any type of arthritis, if you inject A2M, which comes from their own blood, into that joint, you will literally stop the arthritis. So it's pretty amazing stuff. And the other thing it does a really good job of, that I know you can comment on too, The reason you have pain is another protein that's secreted called cytokines, which, they basically, it's the signal that causes pain. The A2M also does a really good job of modulating those cytokines. So most people have very significant pain relief within 12 hours. So if anyone has arthritis, if you don't address the proteases, taking Tylenol or Aleve or Celebrex or cortisone, none of those things stop the proteases. The only way you can stop arthritis is to use A2M.
Yep. And the one of the most important parts of a post-treatment therapy is to supplement, right? To whether it be vitamin D, the multivitamin, as we mentioned before, the essential fatty acids, and this is where Buzz taking it up one level more than just the therapy alone is, how can we get better long-lasting results with ongoing supplementation? And Christina shared some info with me just earlier about how some specific forms of this IV therapy, I think maybe you had mentioned glutathione, enhance the absorption of even some of the things that we're taking orally.
Well, yeah, I mean, anytime you can diminish inflammation throughout the body, you're always at an advantage.
Yeah.
Obviously, with A2M, like, it needs to be directed into the joint because it can't get in there. But if we can mitigate the inflammation in the surrounding area and your body can focus on the knee, then that's obviously optimal. A lot of these things, A2M, glutathione, NAD, they're all produced in the liver. So it goes back to, like, how metabolically sound are you? Like, most people aren't. So they're not producing the amounts that they should in terms of being able to kind of get these kind of results on your own without doing a IV therapy or anything like that. It's not there. Our diets are crap. We sleep like shit. Like, and people don't want to hear it, but that's on you. Like, I'm sorry.
It's going back to physical medicine, Buzz, this protocol that we've put together, a true physical medicine office. A patient comes in and they'll hear this on the podcast. Where are they going to go in their local neighborhood to get all of this done in one place? I know we've taken a lot of pride in creating these true physical medicine offices where literally everything can get done under one roof, from interaction with the patient, giving them a requisition form to get lab work done, getting the approval for an MRI literally the day of and getting the results that day or the next day. So if someone, out there has a problem with a specific joint or an ailment or a fatigue or a specific illness that they've been struggling with, the turnaround time to get all of the information that we need to make an informed decision on how to proceed, whether it be with an advanced therapy like A2M or regenerative medicine or some form of decompression to treat a chronic condition like a disc herniation, and at the same time restore optimal levels of hormones and adequate hydration, you're talking about a turnaround time of really less than a week, where if you tried to seek this out on your own, you're not talking about weeks. This could be months to get all the information that you need to move forward. So I take a lot of pride in the fact that we've put this together.
Well, just getting an MRI approved,
right, Buzz?
Your primary is
it's crazy.
Impossible.
People have these different injuries, and when you have something that hurts you, it's your body telling you, there's a problem. You got to get it checked out. Going to a doctor and the doctor saying, well, just take some, over-the-counter medication and come back in 2 or 3 months and it's still bothering you. You're just creating more and more damage, more and more inflammation. And I think it's really important for people to realize, what we're doing in our practices is, if you come to me, and you have back pain, knee pain, hip pain, wherever it's at, I'm not worried about how I'm going to mask that pain. We look at you and say, how can we get your body to heal itself? Is it, with the use of A2M? Is it with IV? Is it with, shockwave therapy? We have all these different tools that help the body heal itself, because at the end of the day, if you're alive, you have the ability to heal. So when someone's sitting across from me at my desk and they're, and they have a chronic injury that's not getting better, I'm not thinking about how am I going to mask this. I'm thinking about, why aren't they healing and what can I do to help them heal? And I know that's the way you guys look at it too.
Yeah, it's unique. We had a patient just the other day that had been to orthos, the best in town, and as she was doing one of her therapies, she said, how come I don't know about you? How come I didn't know about this before? And I think out of all the good things that we do in the office, we don't do a good enough job of letting just the general public know about all of these things that we have. So I think one of the services of this podcast is to let people know, if you're up in the Midwest, you have to find a way to go see Buzz up there. I mean, it's worth the trip. It's worth the plane ticket to get enough information so that you can decide how you want to move forward with a condition. If you're on the East Coast or down here in Florida, take the time to come and see us. It's definitely going to be worth your while to at least learn more about yourself. And like Buzz said, the future of medicine isn't in treating disease, but it's finding out better ways to allow the body to find out where the dis-ease state is and how to solve it, often cases on its own. So that takes us back to
everybody has
basics.
the ability to heal, Joe. Everybody.
Yep.
So if you're sitting there and you're listening and you've had a chronic problem and you just think it's because you're getting older, it just won't get better, come check us out, and we're not going to waste your time. If it's something that requires surgery, we'll tell you. But oftentimes we're able to help prevent people from having surgery. And just because you've been told medically you have to have surgery, that doesn't mean you have to have surgery. You have to remember, and this is not a knock on traditional medicine, but when traditional medicine looks at things, is there a drug that can mask this or treat this? And if there's not, then you need surgery. They don't look at alternative methods and things like, IV, A2M, vitamin therapies, different things. They don't use those tools, so they can't comment it. So it's always good to get a second opinion.
Yeah, I think Christine is a perfect example. She is, she's brilliant. She's our physician assistant. She pretty much runs our entire medical department here under our medical supervisor. But she was the valedictorian of her class. And when she came to see us, I would say right now, Buzz, in our practice,
I'm probably the most hippie conservative one.
She is. That being said, but she's a healer at heart. If you look at the traditional chiropractic philosophy, is health comes from above, down, inside out. I think Christina is right there with us, or probably even ahead of us. She's. I won't say in terms of physical conditions, someone could ask her for an antibiotic and she'll just about throw them out the door, or for pain medication. So just in her own journey over the last, 5 or 6 years, Christina.
Well, I mean, I will say, PAs are trained in the medical model, so definitely hardcore pharmaceuticals, hardcore disease process, pathology. I think complementary and alternative medicine was one course we took over a period of 4 weeks, and it was basically, well, here are all the vitamins and minerals, there's one test on it, and move on. Mm-hmm. So it's not to knock on my profession, but it's not something that's really taught in the schools in terms of when I came out, we didn't do any of this. It was you knew what meds to prescribe for what diseases, and that's pretty much what you were ingrained to do. So to kind of think outside the box and think of more holistically or naturally was kind of oh, that's kind of BS. I don't know. There's nothing to that. But I mean, there obviously is. And then what Buzz was talking about in terms of masking symptoms, I mean, everyone knows the document effects of, taking ibuprofen, aspirin, any kind of naproxen on the GI system. But Tylenol is another one that people are well, I can alternate between an NSAID and Tylenol because one does the kidney and one does the GI and one does liver. So if I just kind of spread out my toxins evenly, then I won't burden one organ. The problem with Tylenol is that it actually depletes your glutathione. So not only are you masking the symptoms and you're not actually healing anything, now you're actually putting yourself at a disadvantage to actually even attack any inflammation that you have because you're depleting the little glutathione you probably even have in your system to begin with. Yeah. I didn't learn that in school.
No. And what did you mention? You had mentioned the significance of the liver, of all of the different hormones that are made, converted.
The liver is the most important, one of the most important organs. Obviously, you need heart and brain, but still.
Yeah, even the conversion of thyroid hormones occur in the liver. And you had mentioned, people think, well, I'm not taking Advil, Motrin, Aleve, I'll just take Tylenol. And still, year in, year out, the number one cause of acute liver failure is overuse of Tylenol, acetaminophen. Right. So, this is, I know, for example, with working out, if you really want to get in the best shape of your life, find a good trainer that looks the way you want, that has a really good diet, and let them guide you. And it's the same thing when you find or you hear something that you're inclined to agree with, let the doctors that are really expert in this profession help you along the way. You don't have to figure all this out on your own. The purpose of having an office like ours, where there's so many different types of providers, is we're able to look at a patient, one patient with multiple providers on the medical side, on the holistic side, nutritionally, using lab work, using advanced diagnostics to really come up with a cutting edge plan to help a person recapture and regain their health. So I know you're the same up there, Buzz. You have, in terms of your phys med office, you have a medical staff, you have chiro. What else is going on up there nowadays?
And we also have a pharmacist on staff who knows the pharmacology, but he also is along our mindset. He really likes the alternative. I guess he went to pharmacy school and realized, drugs can be amazing, but they're so overused. So it's really nice to have him as a resource and on staff, and to understand, there are pharmacological ways to heal things.
So I think this was a good way to bounce back. I'm back. I'm happy we're back with a healthy dose. Hopefully that was a good shot of information. Like, comment below. In the comment section, let us know what you want to hear about. If you have more questions about NAD, glutathione, IV, oral, supplementation, the long haul symptoms of COVID, or just questions about general health, you can find all of our information in the description below about Dr. Buzz's office up in Columbus, Ohio, and all throughout the Ohio area. And you can find more about us here in the Miami area. Buzz, what's the easiest way to get a hold of you?
I would say just go to our website, which is BUCKEYEPMR.com. So BUCKEYEPMR.com.
You have an Instagram handle too, Buzz?
I'm not good on Instagram. We do. I think it's Dr. Buzz Squirth. I'm on there. You can check me out on there too.
Okay. And ours is at APMRmiami.com. You can check us out at our website, APMRmiami.com. If you have any questions directed at Christina, call us at the office, and we'll catch you next time. Remember, in between all this information, learning, trying to bring it into your life, repair, regenerate, replace, and Christina, with our IV therapy, what are we going to do? Restore, revitalize, and renew. So we'll check you out next time on Healthy Dose. For Dr. Buzz, Christina, and me, Dr. Joe, have a healthy one.
Thank you for joining us. This has been your Healthy Dose. If you enjoyed today's show, hit that like and subscribe button before you go. We appreciate your support. For more information, recaps on previous episodes, and to find out what's next, follow us on Instagram at Healthy Dose Show. Remember, repair, replace, and regenerate. See you next time.